Spotlight. I'm Tiffani Helberg. I am a proud board member at Chamber South, and I hope that you will come and explore all the wonderful things that we have to offer at the Chamber and develop your own partnerships. Today, I am excited to introduce you to Dr. Raymond Ruszkowski with the Family Medical Group. Thank you for joining us.
Thank you for having me.
So tell me a little bit about yourself, Doctor. You grew up in New York, and how did you come to be this fantastic doctor?
Well, thank you for the compliment so far. I think that the inspiration I got when deciding what I was going to do was when I was injured playing football in college, and I was taken to a chiropractic physician, and I was astounded by the treatment that I got because it helped me get back to play really fast. And it was a nice, clean office, and I saw everybody happy, and I said, you know, this might be a route for me to go because I was always into athletics and being active, and I feel like I've always been a healer for people. So at that point, I decided to go to chiropractic school after I graduated from Springfield College, and I went to school for chiropractic in Chicago. And when I graduated, I came down here, and then 23 years later, here we are. So.
Okay. And along your journey, you also participated in sports medicine. Tell me a little bit about your time at right?
Sure. When I came down to Florida first, I was with the University of Miami football program as a strength and conditioning specialist. So I got to see the athletic training. I got to see how they treated injuries. I got to see how their sport performance program was. I worked with Tom Moffitt, who was the head strength and conditioning coach, and Butch Davis was the head football coach. Great program back then. That's when was I guess at the pinnacle of college football. That was a great learning experience. And then in August of 2000, I was licensed and I began practicing, started out in Homestead, and developed my practice and my experience now for over 23 years. And in 2016, I became involved with Family Medical Group, and the CEO, Liz Rodriguez, who's now my partner. We have developed a number of centers and medical centers in Dade County. We're interdisciplinary. We provide full medical services. We provide chiropractic care, rehabilitative care, pretty much the entire gamut of what any physician that's licensed in Florida can offer, including pain management consultations and orthopedic surgical consultations. We do perform procedures in our office in Kendall. Kendall is our main office on 137 and 88. We are looking to South Miami, though, to possibly expand to another location because it's grown so much. So I will be going to the Chamber and becoming a member.
That's great. Well, we're excited to have you join us. A lot of great partnerships built there and a lot of connections for not just establishing your practice, but for bringing in patients and so forth. So tell me why it was important for your practice to have comprehensive care, not just chiropractic care.
So in order to get the best possible results to people, you want to be able to have every available avenue. And in today's healthcare, when people have choices, today it's, I want to look up a review of a restaurant or an automobile or a doctor. And we decided we wanted to provide a more concierge-esque type of service to patients, but we could offer everything. So whether or not you've been hurt playing sports, or you've been in an accident, or you have a cold, or if you have an allergy or some type of ailment, we wanted to be able to service all those populations in a way that where the doctors are more reachable, you can get appointments sooner. We bring a more personalized approach to healthcare. After COVID happened, obviously some doctors went to a more virtual type of practice, but we wanted still to have that ease of access. We wanted to have that customer service base healthcare because we know how competitive it is, especially in Miami and South Florida. So through Liz and some of our other great team members, we've developed a nice program where patients can feel like they're getting the attention that they so crave. A lot of times patients tell me that their primary care or another doctor or whatever is not really giving them the service they want. So we really made it a big deal to be that type of medical center for everybody.
And when a new patient comes in, are you looking at them holistically? Tell me about that process.
So obviously we take a history, make a diagnosis, and then we'll decide what the best course of action is. Now, one thing I can say is that we are still a mainstream medical center. We prescribe medications and treatments that any normal doctor would prescribe. But we do take the angle of a more holistic approach. We promote longevity. So in some instances where certain medications may be the mainstream, We may differ a little bit by providing, yes, the medication, maybe a different type of medication, maybe not for so long. We definitely try to inspire patients to eat healthier, to exercise regularly once they're better. If it's for more of a chiropractic treatment, obviously the musculoskeletal concerns are our biggest driver of, hey, we want to get you back to where you were. We want to keep you there. Again, through things like exercise, nutrition, posture, things that create longevity in people. Because not only people want to be better now, but they want to be living a long life, right? So what are the things we need to do for you to get you to that goal? And we know what we're doing. We know what we're doing. And it's through research, and it's through trial and error, and it's through, again, in my experience, I work with mid-level providers like physician's assistants and nurse practitioners, as well as medical doctors, orthopedic doctors. And we sit together and we talk and we discuss cases, and we work together in-house. So if I see a patient on the chiropractic side of FMG, if I take an x-ray, I will ask one of the doctors or one of the PAs or the RMPs to come over and share in a diagnosis. They do the same with me. And we take our diagnostics in-house, so we have that convenience. And we work with all other diagnostic centers in the area, some of which are in South Miami, to do things like MRIs and CT scans. So again, it's a comprehensive approach to care, depending on what the patient's presenting with. We try to make the best effort to get them well and then to keep them well through things that they do outside of our office.
When should someone see a chiropractor?
Well, for many reasons. One, obviously, pain in your body, pain in your extremities, pain in your spine, tightness, if you just kind of feel off. Sometimes people can sense when they're off, meaning their mental acuity, their physical abilities, their sleep, their moods. Sometimes people just feel it. You come in, we evaluate you. We'll take an x-ray. We'll do a physical examination. We'll ask you about your life, because a lot of times that's missed. We'll ask you about what's going on in your life. And then it's not just manipulation. It's everything from, again, physical exercise, stretching, nutrition. What are the types of nutrition that you're maybe missing? What is your sleep hygiene like? Are you going to bed the same time every night? Are you practicing good sleep hygiene? What is your sleep environment like? Do you have high levels of anxiety? How can we help you with that? There's many ways to do so, medicinally or non-medicinally, naturally. So if you wake up in the morning and you have pain in your body, or if you have headaches, or if you just don't feel right, you might want a consultation, because we can provide all aspects of care to get you well.
And you also do rehabilitation?
Yes, we do. That's something where we specialize in, to be honest with you. So physical therapy modalities, like any mainstream physical therapy modality you would get if you were injured as an athlete. When I was at we performed electrical muscle stimulation. We applied medical grade hot packs. We did manual therapy techniques. Now we have some new technology in our office. One particular is called radial pulse wave therapy, and that is an acoustic pressure wave energy that when you apply it through a transducer head to the body, it actually has a compressor in it, and it shoots a metal bullet inside of a transducer gun to the end of the gun into your body, not into the skin, but on top of the skin. And what it does is it promotes your body to stimulate collagen production. It also causes a process called neovascularization, which is the formation of new blood vessels. And it also overwhelms free nerve endings so that you increase pain. This is what the NFL teams are using.
You decrease pain or increase?
Decrease pain, excuse me. Yeah. This is what the NFL teams are using to get their players back to the field of play faster. So this is a great technology we have. We also use ultrasound. We use low-level laser therapies. We try to stay at the forefront in technology when it comes to delivering physical therapy to patients, because people want to be active. They don't want to have loss of function. They want to be active, and they want to get back there sooner. Some patients are more injured than others, and we definitely cater our treatment plans to whatever the individual patient needs are.
And where are your locations?
So in Dade County, we have 6 primary locations, starting from Homestead to Cutler Bay, Kendall, which is our main office on 137th and Kendall Drive. And we also have Coral Gables area, which is down US 1, 13th and Coral Way. We have an office on 110 and Biscayne Boulevard, North Miami, and then also at the Palmetto General Hospital office building complex in Hialeah, Miami Lakes area.
Okay, great. All over the place and still expanding.
And still expanding, maybe to South Miami in the near future, into Broward County. Actually, as we speak, we're working on expanding into Broward County. Um, we've been fortunate enough to provide services where patients come back, they're loyal, they understand what they're going to get. We're really big on reviews. If you have a good experience, we'll ask you nicely if you can do a review for us, just because it matters in today's day and age. The instantaneous information age, I call it. People want to know where they're going ahead of time.
Is there anything exciting and new that's changed in any of those fields of medicine that's really kind of changing the game when patients come to your office that you can think of?
For the most part, the pulse is I want to be healthier sooner and live longer. So what are the aspects of that? And it goes back to basic human needs. What type of nutrition is best for you? Do you have an ailment? Do we have to work around? Do we have to cut certain things out? The nutrition is the biggest part. Being active, if you can, exercising regularly. As we were talking about earlier, resistance training, exercising in the gym, pushing weights is a driver of longevity. Research it's indisputable now that longevity is driven by a couple things: nutrition, DNA, and resistance training. So because the more muscle mass you have, the less metabolic disorder you'll have, the higher metabolic rates you'll have. You'll keep body fat off. Now, diet is huge because some of the dietary paradigms that have been taught to us in the past have kind of been changed. Red meat is not what some people used to think it is. Red meat is great for you. It's been proven to be doesn't cause heart disease. It doesn't cause atherosclerotic plaque, which is the hardening of the arteries. So little things in dietary management make a big deal. But like I said, decreasing stress, your sleep hygiene is important. If you don't get 6 to 7 hours of sleep, now some people are different, but 6 to 7, mostly 7 hours of sleep, if you don't get that, you're not where you need to be. So we try to teach people how to sleep better, going to bed same time every night, waking up same time in the morning, no phones or TVs 30 minutes prior to sleeping, using aromatherapy on your pillow like a lavender, using candles, taking a hot bath. When you take a hot bath or shower before your bed, when your body temperature comes back down after being elevated, it promotes a deeper, rapid eye movement sleep. Chamomile tea is also a nice thing to have before bed. Also, it's great for digestion. These things religiously are great for you. Supplementation is great for you. Vitamin D, vitamin C, zinc, magnesium. Magnesium might be the most important supplement in the world. It's great for anxiety. It's great for cardiac health. It's great for sleep. But people need to know this. And with the advent of social media, like apps like Twitter, which I think is especially good. It can be toxic at times, but it's especially good for nutrition in my world. You can find out what you need because some people just don't know, or they don't know that they should know, and they should take more effort into creating longevity, not only for themselves, but their family. And that's what we do at FMG. We try to educate people on the little things that you can't just find by walking out the door and going to work every day. So we are a resource for people to get healthy and live longer.
Let me ask you a question. What about these ice baths that I keep hearing about? Is there value in that?
So the cold immersion baths are something that is definitely trending, and there's benefit. You will get a strong growth hormone response after a cold immersion bath. But the one thing that has been shown to be even a little bit more effective is sauna. Sauna has been shown, especially in the Scandinavian countries, if you use the sauna, a couple times a week to a certain time limit at a certain temperature, your life expectancy goes up a lot.
Oh.
And it has to do with growth hormone production. It has to do with cardiac stress and then the adaptation of it afterwards. And so we don't have saunas at FMG yet. We don't have cold or ice baths yet. But that might be the next step.
Interesting. All
Yes.
fascinating stuff. I love to hear about your practice. Sounds amazing. I actually might come visit you.
We'd love to have you.
I'm having surgery and I'll need rehab.
All right. Well, we'd love to have you.
Great. Well, thank you for joining us, Doctor. If anyone wants to contact you and make an appointment, how can they do that?
The best way is to go to our website, thefamilymedgroup.com. You can see our locations. You can see all of our providers. You can see our services. And also we have a strong presence on social media, on Instagram particularly, the Family Medical Group. We are very active on our social media site, as we know that social media can be a great tool to increase your business and the exposure of your business and the populations that you can reach. So thefamilymedgroup.com would be the easiest way. And then from there, if anybody calls in from the show or if anybody reaches us that way, they'll have a direct method to get in touch with me or one of our managers, and we'll get you in right away and get you what you need.
All right, fantastic. Thank you for joining us. We look forward to seeing you at our Chamber South events, and we look forward to seeing the rest of you join us at Chamber South. It's a wonderful way to network with other business leaders in the community and learn more about them. Have a